Everyone's Dr. Morales again. Back at it for another weekly series, patient education videos I do. Got a lot of great feedback from these videos. I'm hoping you learned something. Thank you for your feedback. If you have any more questions, please send them over. Have a question related to the Maui makeover procedure, and that question is, can a Maui makeover fix diastesis? So diastesis is a medical term that we have is for the separation of the muscles of the abdomen, the six-pack, that happens usually with pregnancy. So someone, when they get pregnant, the muscles anatomically will separate and stretch in the middle. You're designed for that, actually, to stretch to accommodate the baby's growth. You know, whether or not you kind of shrink back or come back, it depends on genetics, it depends on the size of the baby, it depends on, you know, your age, multiple factors, okay? So the Maui makeover procedure typically includes abdominoplasty, which is a tummy tuck, which we do repair the diastesis, bring it back together, get you back to pre-baby abdominal tone and tightness. So the answer is yes, it typically addresses that, and it will rejuvenate the abdominal tone and skin tightening with the skin removal. So great question, hope you learned something, and keep them coming.